Hey, everybody. I just wanted to let you know I'm joining online for a few minutes. I got stopped in a big construction snarl, and so I'm going to be a few minutes late, so I'm going to join this way for the first part of the meeting. Thank you. Did anyone hear that?
You did mention something she might need to repeat, but we are live.
Okay.
Driving.
Good afternoon, everyone. Let's call the Region 2 Opioid Abatement Council meeting to order. It is September 25th, 2025. It is 2 p.m. We are in the Goldfinch Sparrow Conference Room of the beautiful Longview Center. So I call your meeting to order. Do we have a quorum? Who do we all have online? I see you, Commissioner. I just want to check who we have online first.
I'm online. I'll be there in about 2 minutes in person. I'm
Okay.
just I'm stuck in a construction zone that they decided to stop everyone from traveling through. So I'll be there as soon as they let the traffic move. So, but I apologize. I didn't know they were going to close the roads off. So I'm almost there. Thanks.
We have Christina Jones, Don Ross, Ryan Mason, Lori Lopez, David Lupa, and I believe that is all that we have on board.
We do have a quorum, so we will continue with the meeting. Welcome, everyone, to the September meeting. Our first action item is approval of the August 28th meeting minutes. Do I have a motion?
I move that to approve the minutes from August 28th of 2025.
I'll second that.
We have a motion and a second. Any further conversation? All right, hearing none, we'll move on. Those pass unanimously. We'll move in now. We've got some grant administration. We do have, if you recall, some funding available for year 3 proposal that we put into our health equity fund block. We had these two grantees already submitted to us, the Family Center and the Hospital Administrative Estes Park. We've asked them to go back, provide us some more information. That's what they're doing. So we do have those consideration. And then we have, we had the letters on action item as well on the agenda, which is weird. So we have our 6-month reports from the Colorado Health Network and the Colorado Health Alliance. So first, can you scroll down, Tom, to
Probably page 9.
Page 9.
I think so. Where you want to start?
no, I'm sorry. It's-
Okay.
Further up?
Yeah, but I want to show right here. Yes, so we have, this is showing that, well, actually, why don't you, Janelle, you put that together, lovely table. Would you explain that for us?
Yes. So after last month's meeting, there was a little over 110,000 remaining in unallocated funds. So I've listed the 3 requests that are on the table today, and it shows you how much we would be over by if all of those are approved.
So what I'm hearing is that if you were to award all 3 of them, that would be $241,434 change, putting us $131,000 in the red, because we've only got $110,000.
That's correct.
Okay. Any questions on that? Yes.
Yeah, I do. For Crossroads Ministry, I thought B1 was, I thought it was just 83. Okay, that's low family. I remember Crossroads being 103.8 and then the second part being 54.
Did they update their requests? Okay, so let me see what they updated it to.
Yeah, so much material. Let's see here.
So you're,
This is what family, I don't think it's that much requested from Crossroads, but
okay, well, what we can do is when they come up, we
Okay.
can see exactly what they're
Yeah.
requesting and adjust those numbers. I still believe it will considerably over if we
Yes, I
wanted to
agree.
consider all 3 of them. Okay, any further questions on this table? Hearing none, let's have the Family Center La Familia come up for the year 3 funding proposal. Hi, Gloria.
Hello.
Welcome.
Hello, everyone. Thank you so much for having me here again. So I'm Gloria with the Family Center La Familia. So last time what we did is there was a line on the budget that was pending. We needed to identify the provider of the peer support training. So we finally made a decision and we are choosing Yarrow Collective to provide the training for the peer support project. So that was the correction that I made and I submitted that to Bruce. That's what we have.
Any questions for Gloria?
I have a few I've got to bring up. Let's see, what page are you on now? Page 8?
Page 7 would be.
Know why my pages now just disappeared. And through your reading, I have down here in my notes that peer support training is listed for the employees to go to on your chart.
Mhm.
However, you also mentioned 10 peer support with lived experience will be trained. Are those the same people?
Yeah, basically, because we have staff that they have the lead experience, they live in mobile home parks. So we're gonna send part of the team, it's not the whole team, we wanna have a mix of, employees that can be those peer support specialists. And then we also have, you know, the promotoras that can train to also provide that social connection.
Okay, I'm still trying to find the chart of what you're.
16.
For some reason, I got this stupid new computer and now the pages are gone and I don't know what page I'm on. So if I recall right, you didn't have the names of the employees listed.
I have the positions listed. It's just the position.
Okay.
Yeah.
I apologize.
No problem, you know, I'm glad to
Should
do
have
it.
brought my little one. I can navigate that one much easier. Let's see, so it also mentioned that all the employees, you have manager, specialist, coordinator, and those are all going to be lived experiences. And it says trained by October 2025.
At the beginning, when I was filling out the form, I didn't really have any guidance on the timeline, but I can adjust that to whatever is needed. Whenever the grant is awarded or the funds are awarded, we need to do the planning that I mentioned there. I put a date, you know, just for me to have some guidance.
And so I guess my concern is, I don't know how long the training is.
The training is 40 hours.
Or just 40 hours?
It's 40
Okay.
hours.
And so it's not a long bit of time before then you can start utilizing those peer support.
Yeah, exactly.
And Yarrow is available soon to provide that training?
Yes.
Okay.
Yeah, I spoke to Ashley with Yarrow Collective.
Okay. And then the other thing, I noticed there was, you mentioned 2 meetings a year for the cohort and families. And I was just wondering, I didn't know if that was kind of standard. To me, that didn't sound like as much as what I like.
So
you know,
2
maybe
meetings
quarterly?
required for each peer support specialist.
Mm-hmm.
Because what we're trying to do is because we work with the mobile home park communities in Lamar County. Well, mainly for Collins, Loveland, you know, that we have those communities that are part of the MIVOS program. MIVOS is a leadership development program that is empowering the residents and, you know, community to be self-sufficient, right?
Right.
So we're trying to train in such a way that they can coordinate with our evaluator because it has a data collection component that is a very strong one. And each one of those, the minimum requirement will be to have 2 social connection events where we can gather that data.
That's all the questions I have for now.
Other questions? Anybody online I'm missing? I don't see your hand.
Let's respond.
Brian, I'm just making sure you can hear us and
Yes, I can hear you, Chair.
all right. Well, thank you for this. We're going to listen to the other presentation and the council will take that up for consideration. But thank you for being back with us. All right, Crossroads.
Chair, if I can, I did find in the chart, it says, for recovery B1, it was 58.8. And then for recovery B6, which is a component with Harmony, was 54.
I appreciate you bringing that up. Yeah, it had changed since last month's meeting.
Okay.
And after I had put that together, so.
Okay, so
it's been
this
updated.
She just sent me the new table and I sent it to Tom. So my thought was when we're done here, we can pull the table back.
Okay,
If that
okay.
works for you.
Yeah.
Thank you so much.
Thank you for
Yeah.
pointing that
Yeah,
out.
thank you
That's
for
great.
pointing that out, because that was on my notes.
Welcome, yeah.
Yeah, my name's Brian Schaefer, Executive Director for Crossroads. Shane Hudson was here last week due to a family funeral that I needed to be at. And so I did get word back about the food, so the lack of, ability to support the food that we had in the grants. And so we backed that out and backed out a few other things. And so we are looking to provide the mental health therapy up to 200 200 sessions on that. And then thinking about the wraparound support with housing, providing some transportation, job training, and connections, and then providing some educational things through some coaching. We found that to be very helpful. And then that's kind of where we ended up, and those were some of the changes. But I wasn't here last time, but I do have a little over 25 years of working in the social work field, and in and out of treatment centers, working with people, working with the homeless, and working in the prison systems. And so I've seen the value of the wraparound services. I was a part of a lot of the reentry programs up in Alaska when we were there. And so thinking about getting clean and sober in prison, but as they re-enter, some of the triggers for relapse were housing, some of the support group, the peer support, if they didn't have a vehicle to get to work or couldn't get a job, and then just having, a personal coach or a sponsor that was there to help encourage. And so that's what we're looking to provide in the Estes Valley. And open to any questions.
Questions from the council? Anyone? Yes, Commissioner.
Thank you, Mr. Chair, and thanks for, I was stuck in but there's no welfare today. I have no way out of my neighborhood today. I'm curious about when you talk to peer-to-peer, you mentioned mental health, but this is actually money for opiate abatement and opiate recovery. Can you share kind of what you're doing with Crossroads Ministry, that you're working with folks in that community that are recovering from opiate addiction?
Yeah. So I mean, we work with a little over 1,000 unique clients throughout the year, and there is a certain percentage that have a background of recovery from opioids, and just in the last 2 years, one of our clients, let's call him Joe, had overdosed on fentanyl a couple different times. We had through Crossroads, we're servicing a lot of areas in his life, but we weren't able to get him into treatment or get him connected with a peer support recovery group. But I did start conversations with Harmony Recovery. And at the time, 2 years ago, they were private, but they merged with All Health. And now they have so many beds open for Medicaid. But then they also made an arrangement with us when we did have clients that were at a place where they wanted to get into treatment for a week, to go through all the, cleaning up and the withdrawals and different things like that, that we had arrangements to get together. And so for us, we wanted to target, our unique clients that really needed that extra support and kind of the wraparound services in treatment as well as when they get out of treatment.
So if I might further clarify my question, I know Estes Park is around 6,000 to 7,000 people. Actually, I was there most of the morning with the governor of Colorado. And I know that it's about, you said 1,000 clients. That's about, maybe a fifth of the population. But that's not all opiate abatement, obviously.
Sure.
That would be large. So, but you say there's one individual. What percentage of those 1,000 unique individual clients that you're serving is for opiate abatement services?
I would say if we went through our database, we would have 20 to 40 that we have a record of that, have had issues of opioid use and relapse, and so.
Okay, that's helpful. Thank you.
Yeah.
Yes.
So on the 54,000 for alumni peer support going over to, if you can just clarify that to me. I know Harmony is doing an alumni they have a staff member that does alumni events and things like that. So is this working with Harmony to bring the 2 staff members that you're looking to hire over to Harmony to do services over there for their alumni? I was very confused.
Yeah, so like we would not look to hire anyone. Like the 2 mental health therapists that we have, we contract with them. They're licensed therapists. One's Christy Capo, co-responder with the police department. The other's Courtney Carroll, used to work with the school district as the mental health specialist, but she's in private practice. And but Harmony would look to bring on a staff member to oversee, building the support structure for more peer support for those in recovery. They do have groups up in Fort Collins and Loveland, but right now they don't have enough staffing to do any work in Estes Park.
Well, my concern is, Commissioner and I went and toured, and I really got the feel that the people that were on campus were people that were involved in their treatment. And for people to just be coming from Crossroads to support groups out there, I didn't get to the impression that that was what they were going to be doing.
No, in the grant, we described that we would be hosting the peer support recovery groups at Crossroads at our building.
Okay.
Yeah.
So this 54,000 that is being requested to be in conjunction with the Harmony would be to help bring another therapist on board for them to then come over to Crossroads for peer support groups.
Yes, and to be available for the peers that needed to reach out in between the meetings. And but that's what we proposed. I mean, it could be a part-time position as well. It's just harder to hire a part-time person to oversee that.
My concern is that we need to make sure that we're servicing the Larimer County community for, and I know they cross over in addiction, but, I know people come from all over to use the facility or to get their recovery from Harmony. And so that's a concern of mine is it's servicing much broader than where these funds are supposed to stay in or help our community in Larimer County. So that's one of my concerns. Thank you.
Thank you. Community members, any questions or comments on this? I'm just curious.
Not at this time. I think when we get the next step, seeing the revised numbers face to face, I'll have a little input.
Wonderful. Anybody online?
I'll just add that it sounds like the purpose of this grant is really to add more capacity to their program. And I hear what the other concerns are too.
Did everybody hear that? Okay, good.
And just one clarifying piece, part of our intake process and requirements to be a part of our programs is that you have to be living within the Estes Park School District boundaries. And so we serve residents in that area, that service area. So if someone was in treatment, if they decided to get a job there in Estes and live, then those would be the ones we focus on.
Thank you for the clarification. Okay, well, move on to your second.
Don't you have the 58,800, right?
Sorry.
He just spoke about the 54.
Okay.
Don't we have the recovery B1 for 58,800?
Yep.
Mr. Chair, I apologize. I had my hand up, but it's probably hard to see up on that
Oh,
screen.
yes.
Nope, the comment had come up and there had been some questions, so I just wanted to make it really clear and point out that the MOU that we're a part of, the state MOU, the listed approved purposes for abatement grants, A1 and A3 both tie any mental health as either a co-occurring mental health issue or as a result from the traumatic experiences of opioid use. So there has to be a connection between the mental health issue that's being addressed and substance use in order for the funding to go through appropriately under this MOU.
Thank you, David. Appreciate that. Brian, you had two proposals. There's one for 58,000, one for 54,000.
Okay.
Can you touch on the 58,000 for us as well?
Yeah, so the 54 is more the partnership with Harmony, with the peer support recovery. And the 58A is, that's the wraparound services, including the housing, the mental health therapy. That would be specifically targeting opioid, issues in a person's life. And then the transportation to and from places that they might need to go. And then any coaching that we would have going on, helping find jobs and things like that.
Are they connected? Is one a standalone, or my hearing one is connected to the other?
Yeah, we're working in collaboration with Harmony.
Could one be supported and not the other one? Why I'm asking is we don't have enough funds.
Yeah, I would say, definitely we've been in partnership with Harmony. But, their staffing is at a place that they can't commit, a permanent person to oversee, the peer support recovery and the facilitation and, all those different things. We could still host those meetings at our building and would be very happy to do that. And so we could make it work with Harmony. We could find some funds to help if this was awarded and this one wasn't. So,
Okay, that helps. Yes, trustee.
To your point, are you currently having peer support opioid addiction meetings at your Crossroads currently?
No.
So that has not happened at all?
No. Anyone that we have worked with, we have, tried to direct them to, AA or NA or, any of the groups that they might be able to get some help from.
And are those, I'm not, fortunately, aware of those in Estes Park. Are there, because I'm not in need, but is there available for people to go to those groups?
Yeah, they can go, and but this one would really be targeted, a little more specifically with trained, facilitators that, work in the treatment world and everything. And in Alaska, worked with those that, were heroin users and addicted to pain pills, and now fentanyl's out there. And and we work closely with the police department. And when there's ODs or whatever, we're getting involved in some of those. And but what we found, we can help people, get back on their feet and get a job. But if they're not addressing the addictions in their life, it's short-lived, and then they're back in the cycle again. So.
Now, the therapists that you have listed in that 58,800 bracket on our screen, you've named them. So they're currently those therapists that you said you've contracted with. And so they currently do come up and provide services. And so you're wanting to fund them for a full-time, or can you explain that?
No, it's a 0.2 on there. So we,
What they're doing now.
yeah, I mean, they're in private practice. And so, so for our clients that aren't in the opioid areas, we just connect them and they fit them into their schedule when they can see them, and then they bill us and we pay them, and we provide space for the sessions to take place. So that could be an area where we could cut back a little, because we do have some other funding that we could help, you know, if we wanted to cut back on the therapy, but then offer some of the other wraparound. I just know some people that I've sponsored before. There's some payers that could go off that, you know, they get back into whatever. If they're behind on rent, they can't pay it, they lose their job, they don't have transportation. So those are the wraparound things that we'd just like to be able to serve people a little better.
And how would you be able to, because we would really have to make sure that those aren't being used, the funds aren't being used for individuals that wouldn't be in that classification. So how do you see, if you are granted those funds, them not being used for, you know, because I know you help our community so much, you know, for somebody that is late on rent, but isn't pertaining to the opioid. How would you keep those funds separate?
That's why we would try to want to partner closely with Harmony, because if they were connected in any way, or if there was an easy way for us to, you know exactly how to confirm a self-report, because, you know, people can self-report that I have a history, you know, of this, you know, opioid use, and I've been in recovery for this long. I mean, so that's one way, you know, self-report. But if there's another way, that do we test, or do we pull up records of the last time they were in treatment, or are they on a Suboxone? Are they on any medications? Or, yeah. So, I mean, this is our first time in this arena with you guys. So whatever has been used in the past to verify that.
Okay, thank you.
But definitely, I mean, if they've OD'd and the police are calling us to help, you know, that we could use that as, hey, you know, they had to bring them back to life because they, you know, OD'd on fentanyl.
I did. For trustee Youngland, there is a 12-step recovery presence in Estes Park and AA both.
Great.
Hold meetings up there. There could be more always, but there is a presence. So that's good to know.
Yes, thank you.
My question for you would be, is there the possibility of some sort of hybrid between these two different programs you're seeking grants for? I love the wraparound services. Obviously, Estes Park is a bit underserved currently, especially through our council. And it would be lovely to see more going on up there. And obviously, we have some budgetary constraints.
Sure.
Having peer specialists available throughout the week, I think, is a really important thing, right? The therapists are an important thing. The partnership with Harmony could yield great results. I personally lean more towards the wraparound services part of your grant. But I guess if we get to a place where we can only fund one or the other, perhaps there is a way to hybrid the two. I'm not sure, right?
Yeah, I mean, we can definitely make things work. And yeah, we have a partnership with North Colorado, you know, Health Alliance. They have a care coordinator comes up, you know, for 4 hours once a week. And so we've tried to, you know, channel anyone that would like to meet with them or whatever. And but yeah, that's limited to 1 day a week, 4 hours. And right currently they're in transition, so they don't have someone coming up, so. But to have someone close by, because when you're meeting with them and they're ready to take a step forward, it's good to call and say, hey, let's get you connected. So,
yeah. Sure. Question.
Thank you. Thanks for being here today. I'm curious about the housing when, it's kind of a round number and client vouchers, but, a lot of this work is because we need to have metrics. We need to know how many people you're going to try to serve. And when you say 40 to 60 people, do you know how many people you're really looking to help get housed and in that area? And is it through, do you have landlord engagement or using the Essex Park Housing Authority? I'm just curious about some of that. And I'm pretty well familiar with the work you do and with the Housing Park Authority, and I've been touring a lot of those facilities in the last couple of years. So I'm just wondering, how, because we have budget constraints, trying to understand that, how much that is for housing up there, because it is very pricey up there. And I'm not sure what that amounts to, how many people. It says 1 unit, and then we see the fringe benefits. That was my second question, if you can just explain what that is. So 2 questions, forgive me.
Yeah. So as we look at the housing piece, we spend a little over $240,000 a year in housing assistance at varying levels. We do have guidelines, and we can only provide so much a year per person. And so I would see something very similar. We always like to have buy-in on housing. So let's say we help someone get into housing, maybe we pay their deposit, but not their first month's rent. They have a little buy-in, because if they can't pay one or the other, then maybe this isn't, going to work for them long term. And but then when they come in, let's say in 6 months, and they're kind of short on rent, we always case manage in such a way to say, how much can you afford? And what kind of payment plan can we help you get set up with the landlord or the housing authority to pay it a little extra every month? And so that's where we would be. And then there are some places, depending on, your record and any offenses in your past, you can't get into certain housing places. When we worked up in Anchorage, sometimes we had to help pay a double deposit to get them in, because that's the only way we could get them into housing. So.
And then can you explain the fringe benefits?
And that would be with more of the mental health counselors. So that's kind of the fringe benefits would be including like any of the fees and taxes that they're paying on the 12,000 that was rolled in from the instructions on the grant. It seemed as though they wanted the fringe benefits rolled in, so that's why we did that.
Thanks.
Any other questions for Brian? All right. Hearing none. Thank you, Brian. Appreciate it. Tom, is it possible for you to be able to put up a chart? We sent it to you via the Zoom chat with the adjusted number. Thank you, Brian. Appreciate it.
Thank you.
Appreciate all that. And Tom's going to put up the table that there's a new one. I sent it to you via, I think, or is this the one?
That's it.
That's the one. My apologies.
Yeah.
Okay, so we have 3 proposals. 2 are kind of connected. And not enough money, which is always the, if we recall, last month, we did award a family planning La Familia on their promotorial program. So that contract is moving along. But we do have these 3, so open it up for conversation. Yes.
I guess we did ask Brian for the Crossroads, but we didn't ask La Familia if there would be any, downsizing or changing of theirs out of that 83
That's a great.
that we could look at.
Sorry.
What's the question? I'm sorry.
Well, come on up, we'll ask it again, so it's probably hard to hear back there, our apologies.
Okay.
Thank you, Gloria. Would you mind asking that again?
Sure. So you're asked if it for the 83,634.23. Is there any way you could alter that program to where you can still have the presence and begin it or enhance it, just not at that magnitude?
Yeah, I can work on that.
And what do you think what would be that number that, would you have that off the top of your head? That, I mean, if you were granted, say you were granted $40,000 or something, what we don't want to do is grant you some money that doesn't really even be able to start that program, you know what I'm saying?
Yeah, yeah, I know. So do you have any percentage in mind?
No, I just, this,
Or just,
sorry.
no, I'm sure that I can work the numbers and, submit a new budget, a new proposal. So, yeah, and if you don't have a percentage, it would be very helpful for me to know if you're looking at a specific amount to be reduced, and then I can start rebuilding from that. It will be very helpful for me, but I can always go back with another proposal into that, just along the lines of what I said.
Okay, thank you.
Gloria, how much allocated for the data collection?
It was 74. I think.
So that's the majority of it, and then it's about 10,000 with Yarrow, 9,000 to train the peer coaches?
No, this is the one that has the Yarrow training. It's about 9,000.
The data collection was in last month's.
The data collection was approved last
Okay,
night.
great.
This is
And I
the
think
other,
that's so important.
the other approved use. The B6 is the one that has the 83, but I can work on that.
Thanks for clarifying.
Yeah, no, thank you. Any other question?
Thank you, Gloria.
Thank you.
All right, further thoughts, conversation, those online?
Can you all hear me?
Yes, Rupa, yeah, we can.
Okay, so I would be supportive of Crossroads, the B1, so the comprehensive wraparound services. And that was kind of my question as well. If that doesn't really, that leaves almost less than half of what La Familia is asking, and if that's even something that they could work with. And did you say, Tom, that they had received, they have like another grant that's kind of in the works? Is there a possibility of adding capacity to that grant with some of this money?
Yeah, we'd have to ask Gloria again.
Sorry.
I'm going to stay up here, Gloria.
Just stay there.
Sure.
Okay, so I'm back. What was the question again?
Rupa, would you ask the question again, please?
Sure. So, Gloria, you were asking, like, how much money are we talking about that we're asking you to work with? I can't do the math off the top of my head, but whatever, 110,000 minus 58. So I think that's,
51,268.
yeah, is that something that you could work with this grant or with the
Yes.
previous? Okay.
Yes, I can work with that number.
Gloria, so Yarrow's training the peers, and then you will be paying salary to them? Or will you be billing Medicaid, or how will the peers be being paid once they're trained?
So the peers, what we're trying to do is train our staff that is key, the one working with families, the ones that are living in the mobile home parks and the promotoras. But if there's a reduction, then I'm gonna have to train less staff. That's where I'm thinking that I can adjust. But I would still like to keep the relationship with Yarrow
Yeah,
for that period because it's essential. They're the only ones doing it here, basically.
yeah, awesome.
It would be just probably less
Okay, so
less people
a few
trained.
less peers,
Yes.
but
Mhm.
same mission.
Exactly,
Yeah.
yeah. That's where I think I could reduce that.
I throw this out on the table for the council. So currently, I just asked Janelle, what are in the the financials for admin for 2025, we're sitting at 290,924. So almost 291,000. We will not be using 291,000 for admin. We won't even be close, probably around 40 to 50,000 for the last 6 months, July to December. If you add up what I've heard just listening, B1 of Crossroads and B6 of La Familia, you subtract that, it would be it's 32,367 over this budget. There is that 290,000 in admin. I would like the conversation of perhaps using that 32,367 to support these 2 equity grants as an option. Commissioner.
Before we get to that piece, can I ask a couple other questions? And this might involve getting one of the applicants come back up, but can I have David repeat again what you had said earlier about how the co-occurring and et cetera, if David's available?
So I am, and I can certainly relay that information. Looking, and I should clarify when I reference exhibits, it looks like on the grant application packages, you reference it as exhibit, I think E, and attached it, and they're supposed to identify how it applies to all the approved purposes. But the exhibit is B to our MOU with the state. The 2 that seem to apply the most are 1, and I'll just read them so that you have the full piece of information. 1 is expand availability of treatment, including medication-assisted treatment for opioid use disorder and any co-occurring substance use or mental health issues. So based on that one, the mental health issue would have to be co-occurring with the substance use issue. Next one is number 3, treatment of mental health trauma issues that resulted from the traumatic experience of the opioid user and for family members. So it has to result from opioid use. So in other words, if you're going to approve any grant funding under our MOU with the state, they have to somehow be tied, the mental health component has to be tied to opioid or substance use disorder.
Thank you, David. And the reason I asked that question is, and I don't, and this is hard because, I'm going through a lot of this right now. And I know you are Director Gonzalez, and I know you are Trustee Youngman, and I know Health and Human Services is going through all this, and everyone is. We're really having strain on resources, and there's a more need and more things than what we have resources for. But with this in the ROAC, that's why I asked David that. We have 2 layers of accountability and scrutiny from state and federal government on making sure we're putting these in the right categories and we can prove that these are tied. And I still have some concerns that with the Crossroads Ministry Group, I don't hear about data collection or how many people served or whether it is connected. They just say they have. And when we had the first proposal, they just wanted more money to help with housing vouchers in general. And I know there's a lot of problem with housing in that area, but we have to be able to prove that these went to help with folks that are having these co-occurring and opiate issues. And I know Harmony's doing great work, and Trustee and I probably noticed that we weren't there as ROAC. We was there. I didn't invite her because she lived across the street. And it's doing great work, and they're doing some Medicaid patients, about 10 to 15 beds up there. I just want to make sure that, because they haven't done this before, I'm not sure they even understand or know the need that they want to do and how they're going to track this. And I didn't hear information about tracking and data and showing that. And then with La Familia, I appreciate the data collection and some of those other things. So even though we could maybe move some buckets around, I also still have my gut in just thinking about the budgets and some of the things that we're doing, just thinking about in general, if there is, maybe we're bending a little too much to fund these, that maybe it's not really going for what that kind of purpose that David said. And I'm really uncomfortable bringing that up, but I feel lately I had to speak up on some things that I felt very uncomfortable bringing up. It was the right thing to do, and I just wanted to put that out there as a conversation because I am concerned about making sure that we can, we have to prove and show to the state and to with the federal grant out, and we have so far, but I feel like with this equity bucket, it's going to be interesting to see how that works. And I do want, we had really hoped to hit for children to help where we're impacted by their parents' death or opioid use. And I still was wondering, I still would like to find somehow, some way to support that as well. So that's all I have to say. Thanks, Mr. Chair.
If I could ask David, do you feel that any of these proposals do not meet the intent of what the COAG has established as authorized?
Well, I can tell you that I only can base that on what's in the document and what's was presented today. My recollection, and the council may remember it differently, was that Crossroads indicated they serve about 1,000 individuals or have, and approximately 20 to 40 of those had a related substance issue. My very poor math is that that's 2 to 4% of the population they served had a substance related issue. So that would be my concern under the MOU requirements.
Thank you for that. Kurt, you had a question?
Yeah, I just wanted David to clarify when he said substance abuse, is that still with just opioid or any substance?
Well, at least,
co-occurred, right?
yes, yeah, no, that's a fantastic catch in how that MOU was drafted, and all I can do is offer my reading of it is that A1 says expand availability of treatment for opioid use disorder and any co-occurring substance use or mental health issues. And then the second one relates to traumatic experiences of the opioid user. So both of those appear to tie it to opioid use and addiction. And then other substance use or other mental health issues would be co-occurring with it. So there would need to be a tie-in with opioid addiction or use.
Okay, thank you.
Yes, Shane.
Thank you, Mr. Chair. And just to add a little to that, we've talked about that many times in these meetings. There are very few people out there currently in the depth of any substance use disorder where opioids are not touching that, right, in one way or another. And often using opioids and other substances. So it's really hard to separate the two. They're kind of just existing as one beast.
You have another question. I do have a question for Crossroads. Sorry, if you can come back. I'm struggling.
It's here.
Did he leave? Oh, gosh. Shoot. Okay. Did anybody, I didn't hear the piece for data collection because they have to be able to come back in 6 months and then in the 12 again to basically show us that this money was truly, and I never heard any piece of that. Did I miss it?
No, that's what my earlier comment was. I didn't hear that, and I was gonna ask them, are you gonna bring it back in 6 months? And again, they do great work.
Yeah.
But I just, yeah.
Yeah, I felt like you sort of touched on partnering with Harmony on that piece, but it seemed a little murky and incomplete.
Mm-hmm. Okay.
Can I ask Gloria a question?
Yeah, Gloria.
I'm sorry, I don't, this is.
Hey, close.
Thanks for being here.
Yeah.
And I know they're throwing you a curveball, but can you give me just a ballpark or just a feel? How many children at, your center are you seeing in your classrooms and the great work that you do, that are impacted by their parents or their family members having opiate, substance abuse disorder, opiate abuse, or some of these issues tied for the behavioral health and mental health services. Are you seeing this a lot, or you have some children that have dealt with parents being incarcerated or maybe unfortunately deaths? I mean, I'm wondering if you're seeing some of that.
So we're seeing, we work with the families through our case management program. In last year, if my mind is, sharp, we provided referrals to Summit Stone for 14 households, different issues. Teenagers are also struggling a lot. But I feel that the culture that we bring, and that's something that I presented the first time, is when we talk about substance use, how does that look, how does that reflect into the Latino, the Hispanic, the migrant community? Because there's a lot of stigma. And to the other question, like, is it strictly related to opioid? It could be a different addiction. So we are seeing our case management program serves 50 families, doing a baseline, doing an assessment, and then follow-ups and connection, and, to resources and referrals. So, I think it's all connected because of the way our culture works. And that's exactly what I'm trying to find out, because in the proposal says, we need to reduce harm, we need to educate, we need to prevent, like children from getting into the medications. And what is a common thing is that families exchange medication. So I'm seeing a lot of risks in lack of education. So I think it's more like how the culture is shaped.
That's helpful, thank you.
And that was 14 to 15 youth referrals to Summit Stone?
Well, this is just for the mental health, because we had a care coordinator agreement with Summit Stone. And so in the past year, actively, we refer 14 households to Summit Stone to access therapy, and support, So like a global number, but really our case load for the year with the specialists that we have, that they're trained, is 50 households, or sometimes more, right? So that's like in-depth case management. It's not just like somebody calls and there's a referral.
Yeah.
And then the advantage that we have is that we have trained promotoras in the past, and these are residents of mobile home communities. That they are like the to-go person, the to-go neighbor for resources. So it's a network that we're trying to expand. At the beginning of the MIBOS program, we were working with 3 mobile home communities, and right now we have 12. So this is really important. And
I'm just going to jump in real quick.
Thank you.
It's a time thing, because we do have to get to year 4 funding priorities. I love the conversation, we're thorough, but I do want to make sure, because we have a November looming date. So I just throw that back out on the table that we do have some time crunch.
Do we have to use all these funds, or can they sit there in the bucket? They can sit there.
Great question. Any further conversation? Is there a motion, a table, anything like that regarding this agenda item?
I would love to see us fund La Familia in whole. I think they're doing great work at economy scale. That would be my 2 cents.
Thank you for that, Shane. I appreciate that.
I would like to make a motion to fund La Familia at the $83,634.23. And I would like to perhaps give Crossroads Ministry an education on, just somehow provide them with so they can come back next time, but have information about how they can give us data and report back.
Can I make 2? Let's do that.
Just
2
do
separate.
2, okay,
If that would be okay with you.
that's fine, yeah, it's a
Just
little
so
messy.
it's real clean for us.
Okay, I'll move to fund La Familia at their request of $83,634.23.
I'll second that.
Got a motion and a second. Further conversation? Just making sure those online, I cannot see you, so I don't know if you have a hand up. Just want to double check with Rupa and Brian.
No comments.
No comments.
Thank you. All right. All those in favor of the motion signal by aye.
Aye.
Aye. Does anybody oppose the motion? Hearing none, that does pass unanimously. Congratulations, and
Thank you.
thank you for your great work.
Yeah, no, thank you.
I concur
Thank
with
you.
Dana on all of you. Got it. Now, your second motion, or
Well, I guess if we can just take a second to discuss, is there any, do we have any organizations that we could, or any help that we could provide to Crossroads? Because they do great work. I just don't think without them knowing that of the reporting and the data that we have to back up funds that we give them, I don't feel comfortable like putting the cart before the horse.
sure.
And I would like for them to come back. But they have to be able to feel comfortable to have this data and reporting piece.
Yeah.
And I don't know if we can help them at all with that.
And I, again, I agree with you, they do great work. And so it's a lot of it do great work, but I feel like from the first proposal to this, I'm still not comfortable in what David had said. I still feel really uncomfortable that this is not quite fitting. And I'm really disappointed you couldn't stay so you could hear this conversation. And so I feel I would not be comfortable unless we really tailor that down. I'm not feeling we could really show through the data that this is actually doing that work. I know overall they're needing funding for their whole program, and it would be nice to understand the need. And that may, I mean, you know, he didn't say how many, it was in the presentation, but still I wanted to ask because he said 1,000, that's what he led with, and it's not really 1,000 people are helping with opiate stuff. So I'm just not comfortable voting on it. I just don't know if we could show with any data, or I don't have confidence they can bring the 6 months data to show that they're connecting with that. And I'm not sure that, you know, the housing piece, there's just a lot of housing needs up there, but there's also the workforce housing extra funding up there that they could have applied as well. So I'm not comfortable really voting on those or reporting those at all today, but I would like to maybe give them a chance to come back and talk more about the data and how they track that.
But I just have a process question about that. Is there a template, or is there specific data that you have historically asked that people kind of can just generally speak to and say, oh yeah, we do collect that, we could compile that and put it in a form for you?
There's lots of other, I think, processes that other grantees have gone through, and with our grant question template, I do think we ask for metrics in that.
John, are you
Because I
on?
feel like 20 to 40 is a number, right? They are saying this is the number of people we're trying to serve. And they have the catchment to actually have proximity to people with opioid use disorder. So I feel like that feels to me like it's quite feasible that they would serve those folks, but I'm not sure if I'm missing something just in terms of the proposal.
To your point, we've had a couple conversations on maybe doing some templates, not only on that, but on the presentations that would probably be beneficial for all of our.
Some uniformity then across, so you could compare, right? Yeah.
I just don't want to go ahead and fund a portion. I want to make sure they understand what it is they're going to have to come back to us in 6 months and give us.
Yep.
And I'm not comfortable knowing that they know that. So.
I agree with you.
Without allocating money from your admin.
Right. So,
Got
yeah, no, I'm not for that.
If we're okay, we're moving on, because I really want to make sure we get to your. So if we can get back onto the agenda, we do have 2 6-month reports. I'm going to ask the Network and Alliance. We know all about your wonderful organizations. Keep those reports to 3 minutes or less. Please, I apologize, because we do need to get to year 4. We're going to call up the Health Network. As all everyone knows, I serve on the Colorado Health Network board. We actually had a meeting this morning. So I excuse myself during these times. And I'll turn it over to our wonderful vice chair, and you guys can call me when you need me back. But if we can keep it to 3 minutes or less, that would be wonderful.
I'm putting my
I'm sorry, every time, this is the network. I'm on the alliance board. Sorry.
If you want to serve on our board.
That's
my heart. It's gonna have to be crazy, so.
Please go ahead. Welcome.
Hi, thank you for having us. Like you said, you know us, you know our work. I don't think I've had the pleasure of presenting to you all yet. My name is Rebecca McLaughlin. I use she, her pronouns, and I am the behavioral health manager. I am in the Fort Collins office. So this is kind of my program, a little part of it.
Hi, everybody. Nice to see you again. I'm Danny Willis. I'm our Director of Behavioral Health and Wellness. I use she, her pronouns, and I support the wellness and connect side of this.
Hi, folks. Izzy Pike, she, her pronouns, Director of Prevention Services. And we're here to just kind of do a presentation for you all. Sorry, I had like a whole spiel, but in like 3 minutes, like go ahead and cruise on down then. So this is just like the typical demographics that we provide to you all. I honestly say let's skip this slide since we're keeping it short and sweet. So this is our continued plan for 2025 with the remainder 6 months of the funds that you have provided for us. For our harm reduction services in particular, we plan on bolstering our partnership with Family Medicine Center. They have started an initiative where they're doing confirmatory testing and implementation of Hep C treatment at our site during our Suboxone clinic. So far, in addition to what we have reported in our 6-month report, I also have 6 completed people who have done their 12-week test and they no longer have the virus. We have 1 person waiting for their results after 12 weeks of treatment, 5 people who have completed their confirmatory this month, 3 that are ready for consult, and 1 that has meds ready. So we're really excited to make that available. For those of you who aren't familiar, Hep C treatment can be extraordinarily difficult to obtain for folks. And so like they're getting their meds mailed to us. We're trying to eliminate as many barriers as possible through our harm reduction program in that way. And then continuing to provide overdose prevention education, warm handoffs, and linkage to care. You can see that reflected in the referrals that we have provided in our packet, as well as the additional community education that we have. I'll toss it to you all for Connect.
Yeah, we can scroll down. This slide's talking a little bit about our 2025 dreams for the Connect program, which as a refresher is drop-in mental health care for folks accessing the syringe access program, as well as wellness and leadership initiatives to ensure that our staff have sustainability in the work. So we've done all these things and we're continuing to do more with them. So expanding access to treatment, like as he was saying, partnering really closely with Family Medicine Center, having our therapists start to learn some of how to do some of those referrals and get the consent forms rolling and things like that. I think we're gonna move on.
I'm not mad about 3 minutes. I'm just a little confused. All right, so community impact. We continue to be out and about the community. For the 20 hours that they are not doing syringe access, our folks are literally boots on the ground doing testing, doing syringe cleanups, doing whatever they can to make sure that we are available to the folks that we're serving. We do lots of tabling events. So if you're at a big event like FOCO MX or NoCo Pride, Overdose Awareness Day, we are there. And we continue to do mass amounts of Narcan distribution. I do have Loveland Outreach on here. We continue to do that on Thursdays in a small basis. However, we have stopped any distribution out of our Loveland location due to navigating some concerns. But we still try to have a presence there. Next slide, please. So just a quick reminder, when you look at these metrics, we are only providing you with half of the data since Summerstone is providing the other half of our funding. That doesn't mean that your funds are not having the same impact though. So if you were to double all of these, your funds are still touching all of these people that we are connecting with. So 118 people saved in the last 6 months, double that. So our team, yeah, and this is just what people are reporting to us. So therefore we also can kind of assume that the numbers are lower than what we have because people may not always share that with us. So we're extraordinarily excited that our folks have built the relationship with our participants to make these referrals a possibility. Next slide, please.
This is some of our metrics for the Connect program, which is newly funded this year, as well as our wellness initiatives, also newly funded this year. Something we've learned is that it takes about 6 months to really get a program going. So within that time, it's been me, and I have some other duties to do. So we've had some hours. There's a slide that kind of shows the hours we're doing now and what we're about to have. But it took us a while to find the right person to hire, get the right interns in there. So we have a lot of unique encounters, not quite as many direct interventions as we were hoping to see, but we're really anticipating that number to just explode now that we've hired. And same with MAT referrals to Family Medicine Center. And like we know, it takes a while to build trust with communities. And so we're really excited to now have consistency.
In addition to that, what we have been doing is focusing on the people, the staff. So in the first 6 months, program development is essential, and how we develop our staff to be well and healthy is really important to us at CHN. So we've done triple the amount of professional development and training to ensure that everyone has that trauma-informed de-escalation skills, trauma-informed skills as well, resilience, wellness, all the new hire trainings that you need to be able to be successful, to set boundaries, to set intentions, and to be successful. So we've doubled down on that with our hiring and our new intern cohort. We've also been supporting wellness benefits. As you all know, we've been doing baseline assessments within the program. So we are contracting with Resilient Colorado, and they've been supporting us to do 2 different types of resiliency assessments, which we're super excited to have baseline data. We're seeing that our staff are well, so some of the data is coming in, and we're also seeing that they need more support around procedures and policies and all the things we know to be true when developing new programs. So we're excited to share all that data with y'all as the findings continue to come in. We'll also have secondary data before our final report. We also have been doing leadership trainings and focusing on mentorships of our leaders through their own engagement and what that looks like for them, as well as leading during unprecedented times and different supports that we've asked for. Lastly, we continue to wrap everything we do in individual and group level consultation, group supervision and support, because we can't be well without each other. So focus on that. That's what we've been up to.
Next slide, please. Yeah. This is the hour slide I promised you. As you can see, 4 hours a week compared to being open during the entire time we've got syringe access. You know, within reason, right? People get sick, people are allowed to take vacation, but we're really gonna explode that access. And I think we just have one more slide and then we're done. So this is our budget spend down. We operate in arrears. So we're gonna have, this is only through July. We know we owe you August, and that is on the way. But yeah, we're on track for many things. And the ones where you see 0%, we spent some money in August, I promise.
September.
Yeah.
So we did our annual staff retreat, and all of the stuff that Danny was just speaking to was that definitely spent that down. We're a little bit lower on personnel due to some unfortunate turnover, and we're on track for supply spending for comprehensive harm reduction supplies.
Our one note is it did take us about 4 or 5 months to hire our integrated clinical care coordinator, the one that's going to be facilitating Connect all day alongside Rebecca. And so that's one note that we may have a little overage there that we'll need to tend to. That's it.
Awesome presentation. Thank you. Questions? Yes.
I just want to say thank you for explaining kind of the delay and why and that very detailed spend out. That's the kind of data and stuff that we really appreciate. And I just want to say, you know, thank you for all of that. When I was looking at that, what you shared just now really helped, you know, solidify what I had gone through in the packet. So I just want to say well done. I just appreciate all that data, even though you kind of had to quickly do that. So
Thanks, Jody.
Others?
good job. I'll make a motion.
Yes.
The 6-month report and to approve the next 6-month allocation.
Second.
Got a motion and a second. Any further conversation? Hearing none. All those in favor?
Aye.
Aye. Anybody opposed? None. That passes unanimously. Great job. Great job. Hepatitis C treatment, if it is not managed properly, can be $100,000 to society, just so you all know. Now I'm going to exclude myself. Do I have it right or am I wrong still?
I got my clock. Okay.
Oh, you got the clock out for me. I didn't see that happen for the other folks. All right, I'm gonna be speedy, but do my best to make sure you still get all the context you're looking for. This is still their report, I think. But I'm MJ Jorgensen. I work with the North Colorado Health Alliance. While Brooke's getting us to the slides here, we really have three primary buckets of work under our scope with y'all. And that is connecting people through care coordination and recovery support as one bucket. Community education as a second bucket, and provider education as a third. Proceed. Overall, we are either completed or on track for completion in all three of our buckets. And so that is the high level 40,000 foot summary. Trying to go fast. Keep going. See, the check, we're on track. Yes. So this is a quick summary slide, and I don't want to block anybody's view, but ultimately, in the first 6 months, we were able to initiate 259 care plans with our staff funded through the council with 189 unique individuals. From these individuals across those fine folks, 503 individual appointments across them. And in addition to that, completed 452 tasks. And so that's what we call it internally when we go and do something for somebody and document that. And so there is a summary over here of some of those bigger tasks that were completed overall, resulting in 16,881 minutes of work from tasks tracked outside of meetings. Gotta keep going. I think I'm already at 2.5. Okay.
No, you're at 2.
Oh, I'm at 2. Great. We also had, I believe on the previous slide, but don't scroll, it will take more time. 126 peer support groups were completed in that 6 months. Community education, keep scrolling, Brooke. Yeah, I'm just gonna keep doing this. Actually, that's too far, sorry. We in the end of August and September, early September, completed 3 overdose awareness day events, all really, really successful in Fort Collins, Loveland, and Estes Park. Estes Park was the busiest I've ever seen. So that was a massive win. It was in Bond Park. We had Jason Lentz, our local musician, come in live loop for folks, and we had folks who were there on purpose and folks who were not there on purpose. And that is a great blend to reduce stigma in our community. And so to that end, distributed a lot of testing strips, a lot of naloxone, a lot of education, connected providers together and connected people with those providers. And so overwhelmingly a successful set of events throughout that closing.
Okay, great.
Yeah.
We're there.
And these 2 numbers you should see.
Yes.
Yeah.
Okay, that's 3 minutes. A little over, but
You have questions?
take a breath.
Sure.
Questions? Line up when no one else does.
Yes.
Great work. I love going to the event. I wish I had been at the Estes one because I heard you also had, I'm sorry, I missed the elk. I heard elk.
We did have some visitors.
But that's in my backyard too. And I know this is not part of your report, but I have concerns. Kind of the dashboard in our community, because you are throughout the whole community and you have some really great data. If there's an uptick in numbers that because your numbers are outstanding every time, but what does it look like? Maybe something we can talk about at your 12-month.
Yeah.
What is this, since we started the grant programs, have you seen greater numbers? What's changing? What's
More like thematics.
yeah, in the community, just wondering if there's something for us to also have as a council to understand the landscape from your organization's perspective. I think it might be very helpful, and I think that you're right, that Estes Park one was really a magical thing to have people who were accidentally learning and some they were purposely learning. I think that's really powerful. So I wanted to just ask, think about that and ask about that, because I think that's really important. Just to kind of, I don't know, kind of a pulse on how our community's doing overall, because even though all this great work's happening, I still feel like people are a little stressed, and so wondering what that's doing. So I'm just curious if that would be okay to think maybe at the 12-month, and not asking you that today, But just something to think overall, to give us maybe some information as a council, like
collective,
just,
yeah,
that would be great, if you wouldn't mind.
Yeah, and I would like to tap in that's coming back there as well, to make sure that I'm not missing something. Jared, for reference,
Let's move
for
this
those of
maybe,
you on the call.
yeah, if you want to.
But Jared and I have had conversations similar to that on how we align the work that's happening with population
Yeah,
health.
so maybe we pause that question, because we have our meeting with the opioid data group on Monday. And might be good, and you're here as well, and so maybe we can put this on the agenda for us to have kind of that conversation in general as we go forward. Is that part of that metric thing we talked about, the data and the templates, that's all part of this? And maybe that could be a good time to have that information. Not that I don't want to ask you guys to present right now, but I know we're pressed for time.
Yes.
But maybe Dr. Olson, if you're still at the end of the room, if we have any time left over, you guys could pop up. I'm just overall worried about everyone right now, so.
Same, beautifully worried.
But, we have a question, I'm trying to. I would love to make that
I'll
motion.
make a motion to accept the 6-month report and to fund the next 6 months for the Northern Colorado Health Alliance.
Is there a second? Because I'm chairing, I can't.
I'll second.
Thank you. Mayor Pro Tem Mason, I appreciate that. All those in favor of this motion?
Aye.
Aye.
Is there anyone opposed? Great, thank you. Well done.
Thank you.
Certainly not during my time. There's a conference happening, by the way, on October 28th. That's on the other scope that was not referenced during the presentation.
Only over by 20 seconds, Mr. Chair.
Okay, we're moving right along. Good stuff. Appreciate the conversation and the good work going on to combat opioid use in our community. Next is we got a task. We do this every year. We got to plan our priorities for year 4 funding. We have Dr. Jared Olson back up here. For those that were a part of the council last year, Jared and Amy Artonis with Behavioral Health Services and Laura Walker helping out. Jared, if you can give us a couple minute overview of kind of how you got there for the new board members, and then we can kick it off on, let's start filling buckets. Now, remember folks, Janelle's told us probably 5 ways to Friday that we could say 25% for G9 or something. And we turn that in. That doesn't mean it's stuck 25%. We do get leeway to maybe go to 30% or 20%. So this isn't etched in stone. It's a good start, correct? All right, Jared?
Okay, so, yes.
Sorry, Dr. Olson, give me. I just want to share, I was at the overlearning opportunity. And I want to mention this because I think we need as a council to have that in the back of our heads. How important this work is, and we might have to be doing it sooner because really the deadline was in September for submitting this, but the COAC approved the November date. And so that was added, so really and I was surprised to hear that, we had a whole discussion on it. But I just wanted to inform the council that there was a discussion, since it's confusion that a lot of people were like, September was, and now we have, was added, they had to be approved by the COAC to have the November date, it wasn't an automatic date. And so there's a discussion about whether to just get rid of the both dates and just focus on the November. It seems like everyone's looking to have the November. And so I shared that I thought November was something our council would appreciate, but I wanted to make sure you knew I had represented that we wanted the November date, but I just wanted to share that because I wasn't sure if that was clear. And also we were the lowest in getting our things signed and turned back in, so hopefully we have that all taken care of. But I just wanted to share that, but I wanted to just share that, this is next, hopefully they approve that, the COAC, that we won't have to, but it is a deadline, and this November date was an added date. Thank you.
Thank you, Jared.
Okay, so how we came to the initial allocations last year, or the recommended allocations last year, which the board approved, was based on the previous allocations, the types of organizations the group had funded, the needs in the community that had been identified, and the applicant information and feedback in that data. So that was the initial allocation, which we can go to in just a minute. In reality, there was additional funding last year. So we started in 2.8, I believe, and ended up with about 3.5 million in that budget. So for that, instead of the initial allocation of about 25% to recovery, this is the biggest category. That does involve one carryover from Harvest Farm, but it was about 39, almost 40% of the overall budget that you all allocated and spent last year. If you take away the carryover, it's about 35%. Then each of these categories were effectively reduced slightly because of the overweightness to the recovery. So why might that be the case? I think there's probably two parts that play a role here. In one sense, there's definitely need for recovery, and you had a number of organizations, including new grantees, that came into and applied for funds and have been reporting on this. Additionally, this has some of the most costly measures, right? So anything involving housing is probably a higher cost per person or per individual relative to some other approaches, whether that be prevention, harm reduction, things like that. However, we know, the council has certainly valued housing and identified housing as a key stumbling block, especially on that road to recovery, that is essential for folks to maintain their recovery and treatment. So this is how you were allocating, in reality last year. And if we just took those funding levels for these broad categories, right, B and C, J and K, recovery, planning, coordination, prevention, harm reduction, treatment, and then admin down here. If you just allocated along the same levels, you'd be about $1 million in recovery, almost $500,000 in planning and coordination, about $400,000 in prevention, $150,000 in harm reduction, and about $300,000 in treatment. So that would involve. And now on this side, you can see what are the organizations and what were they awarded individually last year. So for example, if you had a concern about particular geographic location being funded, something like that, you could see whether or not and to what level that would be there. Now, of course, if we're going from a budget of 3.5 to a budget of 2.6, that's going to be a cut in every category if you just translated it over.
Questions for Jared?
Dr. Olson, and I know the team that worked on this, the way for me, how my brain works, this is so well laid out and and I really liked how you added the grantees on the other side. So we kind of gave the visual of what we've done and how that went. And I really appreciate you explaining with the bucket B, the yellow, the exhibit, the bucket, the top buckets.
Yes.
That we increased because we had some folks come, in the year and that added to that. But that was also kind of that equity piece that we were looking to address.
Yes.
So
Can I just specify the equity real quick? So there is still that 110 in there. Some of what you just awarded today to La Familia will remain in that B6 category, I believe. I believe it's B6, but I might be wrong on that, but I believe it does stay in that category. And the other award to La Familia is down here, so that moved to G. So you do have some moving into prevention as well from the equity money, and then EVIX is this last one, which also remained in that recovery.
Awesome, that's helpful, thank you. And I hadn't even made that connection that money was still in there, so thank you for highlighting that. So I wanted to just repeat what you had said, that, getting this done and having this submitted is really important, and that these are not carved in stone, these are just general buckets that we could adjust going forward. Even the amounts in the buckets, we could flex and accept. Is that correct?
Yep. So as just a reference, this one started at 25% last year. This one started at 25%. I believe this one was also 25%. This was 10, this was 15, something like that, right? So all of them moved and adjusted as you did.
And then if I might, Mr. Chair, another question.
Sure.
I was wondering about, this is not including the secondary manufacturers or the SACs, was it the other new ones we just signed off on that? that's not including that money yet?
I don't have any indication that that money will be coming to the Regional Opioid Abatement
Is
Council.
this all individual?
I thought that was to the municipal.
Yeah, I thought so too, but I just wanted to clarify that because I wanted to make sure I understood that fully. That's why everyone had to quickly sign that off. So, okay, that's all I had. I just want to say well done, thank you.
Comments, questions?
Very helpful, thank you.
Is that a confirmed dollar amount for next year?
Yes, the 2.6. And David, if you're still available, jump on if you have any new information regarding the 2026 total funds, that would be great.
Does not look like David is on.
Okay, David did have to step up, good. That's where we're at, that so far, every year we've been doing this, that number's changed. So
Yeah.
it usually goes up.
Yeah.
That's what we go. Yes, Trish.
I'm just wondering, I mean, it can change, so it's not a big deal to spend a lot of time on. But it seems like the administrative cost bucket, you know, is quite large, and I'm just wondering if maybe we could take some of the percentage, you know, maybe bring that down to a 6 or something like that. But we can always take out of it, although, yeah, I don't know. I'm thinking maybe of not having it increase to the 9.85.
Your initial allocation here was 0 last year.
Oh, it was?
It was when you initially allocated it. But as this number grew, this one absorbed some of it, right? So there's certainly, you know, as Tom mentioned, the spending on this will not match the 290,000 that remains in the account. So that's not this would be additional to that account. So you can certainly think about using this to fill in whatever shortfalls
that
the council prioritizes.
And I know John has his hand raised, but yes, Commissioner.
Just before, can I just add real quick? We had talked, we're bringing forward from the opioid group, and I know Laura Walk has been working on this new charter where we would be, we had used, the Butler Group, we had given a grant out of one of these buckets for them to do the work. The suggestion coming forward is to fund it out of the administrative costs. So it would be coming out of the administrative costs.
Right.
And that would take a big chunk out of that and then allow the grant that was used, we use money out of those buckets for this year to be able to use for other grants. So if we keep that in administrative as is, we still have that flexibility, but that grant, and I know if it's up there.
It's right there.
Yeah, so it was 75,000.
Yeah.
And so that would lower that. So just wanted to kind of highlight that because we're gonna use that as administrative costs and not, we'll be presenting, hopefully the council will support that, use that to administrative costs and then keep the availability for that 75,000 for a grant. I hope that helps a little.
No, and I knew we were gonna do that. It just, you know, I mean, I don't like to hear, you know, see that you have $300,000 in administration, you know? I mean, I just would rather see it in the other buckets a little bit. I know we have that Butler Institute, but that doesn't come close to the funds that we have in there. And appearance to me
So can I give
is a little
John,
high.
because I believe there has been COAC has given us a threshold we can keep on admin, but I believe that's probably what John wants to talk about. But John?
Oh, I just want to confirm, and I think everybody remembers it's a 10% allowance that they give us for admin, a maximum. But that unused admin can't be rolled into new admin for next year. It has to be rolled in and put into the total kitty. So when you look at 2025, we have that 346,000. We're not gonna use anywhere near that. And that'll all be rolled into the 2026 amount of 2.6 million. So you're right. It's gonna change for many reasons. And right up, we already know we're probably gonna add $150,000 to $250,000 of unused admin into next year. I just wanted to point that out.
Thank you, John. That was very important. Appreciate that.
No, I appreciate you sharing that because that was, I was wondering about that. We did have that discussion with the learning one, and I appreciate you remembering that, John. But also, I feel like I need to have someone type, voice to text all the information out of those meetings. So that's
One of the ways that this seems to be used most frequently is to give some sort of sense to the grantees. We've heard this even today, right? How much is potentially available as I look to design my program, right? So if you, for example, want to reallocate all of this or all of the remaining amounts and some portion of this or all of this for, we could, for example, we could take what was spent in the last fiscal year and just match it and leave that at. And if we did that, you would have an additional quantity here and we could just reallocate according to these percentages, according to the original percentages. But that would give these grantees, for example, here in planning and coordination, a sense of what's the total available funds and what portion of that might we be competitive for given previous funding levels.
Good point. I would like for us to do that because I think that's really important to have that information as accurate as we can for the applicants. And we certainly know that that's way too much money anyway. So I would like, and I'm okay with just doing it at the percentages that you have presented.
Well, again, I go back to that, if I might, Mr. Chair, sorry. Like I said, this is not carved in granite. We have a lot of flexibility, and we don't know, that's what the money was this year. We don't know what maybe we're bringing that forward, that Butler presentation, maybe the next month or something. We know it's coming on the agenda. So I think if we can get just these general buckets, like I said, Dr. Olson was great about this, just gives them a general idea of what the buckets might be and the amounts. But we are really good at the council being very nimble, like we did the equity bucket, to try to find the right fit for the rest. And I really appreciate this kind of follows a data approach and following kind of the previous and how we're kind of tracking that, and then knowing that that's kind of what we have to look at for the next year. I think it also gets us kind of in that we're going to have to start thinking about we have less money and it's going to keep going down.
Yep.
And so I think this is maybe a good exercise just to kind of, I like the way the buckets are right now. We can always adjust them next year, but I think we're going to have to, it's unfortunate we have less buckets, but we're going to have to start looking in the future and have a big discussion on, and this is what I really want to make sure we leave money for the Butler Institute for how do we look at that return on investment and really deep impact, and how where you invest in the funds to really, build systems or support things that are going to be sustainable and really move the needle and save lives. So I just wanted to kind of think that maybe that makes it simpler for us just to get our report submitted so that we can get our money, because otherwise we won't get it till next year, and that's going to throw a lot of our grant timing off. So.
Yeah, one quick, what Commissioner is referring to, you get it in prior to the November 15th deadline, that funding becomes available rather quickly, versus we've got to wait till March, then our funding comes. So it's just a timing thing, but about 4 or 5 months, so that's the big timing piece. Shane?
Yeah, thank you, Mr. Chair. This is excellent. I think this gives us such a good view of what's going on. I think adjusting everything down right proportionally is the right thing to do now, just as it's been done. I think these buckets are great. The one thing I would say about the administrative costs, if we're going to take a look at what was actually spent this year and pull some out of that bucket to reallocate before we submit, we should still be increasing from what was spent this year, 15% or so. Because I love like what happened today in the discussions that then we've got this like surplus fund, right? That can be moved around. We find ourselves unable to fully fund grants in any particular spot. But this is excellent. I think in the interest of expediency, to echo what Commissioner McNally was saying, I think we're in a really good spot to move forward without spending a whole lot of time fiddling.
Thank you for that, Shane. Others, like Marshall, your opinion on?
I like it the way it is.
Okay.
Everything has been working for us, and I'm 100% if it's working, don't change it. That's just me.
Thank you, Marshall. Online, thoughts? Yes.
So yeah, my question was, again, being new to the council, were these particular categories selected based on an assessment of need in the community, like services that are provided with other funding? Like, is this filling gaps? And is there an assessment being done of what gaps are being created now that we are seeing this collective reduction in funding across the system? Are those gaps shifting or changing in any way that we might want to consider in selecting funding categories?
Two excellent questions. Glad you're on the council. Jerry, can you answer the first question, please?
So as far as the selection, yes, it did look specifically for gaps. So for example, one was, housing for women, right? Housing for women was one that's come up repeatedly. Housing in different parts of the county was identified as a gap. Addressing the needs of pregnant persons was identified as a gap. We also looked at, one of the big pushes I think that's been successful in our county has been the harm reduction, the Narcan administration, so that and saturating that so that folks, both as NCHA and NCHN cited, they are reporting lives saved in that fashion, and we have seen a reduction of all of our overdose deaths across the board since 2021. So that's, yes.
Yes.
And I hear what you're saying. That's what we're doing with the opioid data collection subgroup that we're doing. We're coming up with kind of we're looking at the data and also coming up with questions and hearing from the grantees and helping them. Also, they're doing some grantee support, but a lot of this data in the charter should help with some informing the work going forward. But I do go back to this, that these buckets are great, I think, to start from, and we might, if we have some more discussions, which I hope we do, going forward, we can be flexible with these. We have done that every time. They're not carved in, I always say carved in granite, but that's the only thing I can think of because we have so many budgets that are moving and shaking right now. My eyes kind of get blurry. So I hear what you're saying, and that's why it's great that you're here, Vanessa, because I think sometimes we do need to take a break and take a high level. That's why we have Dr. Olson and the Butler Group who are in the back of the room and some of the separate subgroup that Mayor Pro Tem Mason and I were serving on and doing that work. So we have a meeting on Monday. And so I think that will help inform some more of that thinking for when we start having more presentations. Hope that helps.
Yes.
I was just gonna make a motion.
Did you have a comment or?
Just gonna add on a little bit. I think I lost my train of thought. I totally lost it.
We can come back.
If I remember, I'll catch you after the meeting. Yeah.
It'll be a little early. Get off the bus, but.
Yes.
I'll make a motion that we move forward for 2026's fund allocation and buckets, I guess, as presented by Dr. Olson. I'll second that.
Motion and a second. Any further conversation?
But did have a quick comment she typed in. She said, I think I'm about to lose service, but she's in support the same amount for next year, in particular recovery. I think support housing is important.
Perfect. Thank you for sharing. Okay, great. Okay, we got a motion second. Any further conversation?
Does it include the reallocation of the administrative costs or leaving those in? Just
I was just gonna leave them in at this point.
I thought my understanding was that leaving it in because we can, as I think Shana mentioned, we have that in case we need it.
Thank you.
Did you cover that? So.
Everybody's got that motion on the table? All right. All voting members, does anybody oppose this motion? Hearing none, that passes unanimously. Excellent. Well, great work.
Thanks to Dr. Olson.
Yeah, he don't let anybody forget.
Much faster than previous years.
Yes.
Well, there's been a ton of work in year 1 and 2. We even had a facilitator, we on the board, we did all those things. So there's been a lot of work that's gone on. Yes.
And I want to just comment on that. I mean, this seems like this is easy, but this is admin costs right there.
Yeah.
Okay?
That's right.
And not every county and every region has that. And they actually pay administrative cost to have facilitators and to have outside agency help them do this. And so, forgive me as being a county commissioner, but I don't want to lose sight that we're very fortunate. We have a wonderful place to meet. We don't have to rent. We have, epidemiologists. We have Laura Walker. We have just some amazing folks in our health director, all these folks that we have some great resources. And all of you bring in all the insights, but and anymore, I guess I'm just budgeted out. When I see people and time, I think dollar signs. So it's just drilled in my brain right now. So I just wanted to say thank you all for recognizing that. And I think the simpler we can make this, but I really appreciate the conversations today. And I have a feeling with those numbers going down and the need going up, we're gonna have some hard conversations like I've been having lately. And I just want us to kind of be thinking about that and kind of thinking what that looks like. Thank you.
I appreciate that. The one really good news here was when this all first started, we were supposed to be at 800,000 right now. So that's a much different kind of money. So that's one piece. However, to your point, by year 5, 6, 7, it's gonna drop down. We will be at that 800,000 probably by year 8 or 9. So that's the piece of this all. Okay, we do.
I found my train of thought.
Oh, good, thanks, please.
Thanks. So because you're newer on the council, right? I mean, so much of our mission and objective has been to help kickstart some of these organizations into rolling. And so also echoing Commissioner McNally a little again, as we're moving into this next year with reduced funds, I think it would be prudent for all of us to take a really clear look at who we're funding, who is kickstarted and on the way, and of course, who's using these funds most effectively in the community, thus recognizing gaps that are forming, right, or gaps that are still underserved, and adjusting with our grantees, right, based on their needs and the needs of the community. But so far, just based on the last 2 presentations we saw, I mean, the numbers are looking much better. Makes me very happy.
Yes. Well, that is our agenda, but I do want to take a few minutes while we have time to talk about our next 2 meetings. We do have a meeting in October, our regular time. We've extended that by half an hour to go to 2 hours, partly to accomplish this work, which we did today. And then we do not have a meeting in November, if you recall, because it's on Thanksgiving. We didn't think that would be very good. So and then the next one is around Christmas. So we settled on December 4th. We are having some challenges that appears this room may be occupied December 4th. We're trying to see at the Blue Spruce campus. We may have to find a different location for the 4th. We'll figure it out. But if you can scroll, it's the second page of the agenda.
Okay.
If you look at December, and this is partly something we're gonna have to talk about, so way up at the top, I think page 2 or 3. There we go. Is we're gonna have lots of reports. So December is packed. One of my thoughts now is those that are really close to the 6th month in October or what, maybe we could bump them to October if they're willing to do that. So we are not doing all of that in December, but certainly open to any ideas from the council.
I think that's a great conversation, but also I'd like to make sure we keep space for the subgroup, our group needs to present on the opioid data, and I'm thinking we need 30 minutes, 30 minutes for that to present. So, but I do think those 6 months, if we kept them to 5 minutes or less, we probably can
Get through them
quickly. So I think that's a great idea. And I just want to suggest, Mr. Chair, we looked at Loveland. I know it's down at Loveland Peridot, but
Yeah, that was our next up.
yeah, so I think that's would be a great room. But I do agree with you on that, and I'm glad we got that on the calendar because I was panicking all of a sudden, like, oh, I hope they got we're gonna have to cancel some things. So.
All right. Any further information for the good of the matter?
Oh, one other. So this report, just to clarify my brain, that is going to be submitted when? Our buckets? Before the end of September or?
Yes, we can. Yeah, we'll work with you now. We'll get her in.
Great. I don't want to be at the bottom of the list again.
No, we'll be in the middle or top. Any other comments, questions? Doesn't matter. Hearing none, anybody want to adjourn this week?
I will move to adjourn, Mr. Chair.
We got an adjournment. Anybody oppose that?
No,
All right, good meeting, everyone. Great work. Very thoughtful conversation. Thank you all. Good work here.
Thank you.
7 meetings in Canada.
There you go.
There you
go. That's pretty good. Yeah, I'll see you. Good to see you. Yeah, you too.
I know boxers.
Does that mean they turned in at the same time as the fourth one or 6 months?
Yeah, well,
We kind of grew up this and then
Our son, you know, the baby, he's back. He's got a sister.